short brief on the AU-IBAR and the situation analysis for the One Health in Africa from animal health perspective, and then the IBAR vision and actions for One Health, and last thing is the digital One Health that we are trying to achieve through our projects. Okay, the office, InterAfrican Bureau of Animal Resources, started in 1951 as InterAfrican Bureau for Zoonotic Diseases, and this mainly for the eradication of brindle pest from the continent. And then in 1956, it evolved for animal health in the continent after the formalization or the establishment of the Organization of the African Unity. We joined the Unity in 1965. In 1970, it becomes as Inter-African Bureau for Animal Resources, and the mandate is to lead the development of the animal resources in the continent. And in 2003, the office denoted as a specialized technical office under the Department of Agriculture, Rural Development, Sustainable Environment, and Blue Economy. So in general, our vision is an Africa in which animal resources contribute significantly to the reduction of poverty and hunger. For that, our mission is to provide the leadership in the development of animal resources development initiatives in collaboration and working through the regional economic communities directly with the African Union member states. And our mandate is to support and coordinate the utilization of the animal resources, including livestock, wildlife, fisheries, and aquaculture, and also bees. So the situation analysis for the health and the One Health context in brief, starting from the population. There will be in the coming future an increased number of African people in the continent, and that foremost will be accompanied by increase for demand for food. And that means there will be cross-border trade, movement, and increased urban migration. In terms of resources, the resources are limited. We have environmental degradation affecting the ecosystem balance and health. And this, of course, will lead to more emerging and re-emerging diseases, including also the zoonotic diseases, for which 63% jump in diseases spread from animals to people are reported in Africa. So, how to overcome this? How to do One Health governance? We are faced by many challenges. First of all, there is weaknesses in awareness among the communities. There is also lack of extension services at the grassroots. Silo mentality, where all the directorates are working separately. Poor coordination and collaboration. Narrow view, like One Health is just zoonotic diseases, but of course it's beyond that. Lack of integration and harmonization of data, even within the One Health domain. So there is also weak uptake of technology and poor application of scientific research's information or innovation. The last point, and we will be focusing on it, the lack of governance and digital sensitive policies. So what are the solutions? Is a transformative One Health approach where all the sectors will be collaborating and working together to ensure improved health delivery systems for animal health, human health, ecosystem health, and also to ensure the increased animal productivity, but we should consider sustainable natural resources usage while improving the food safety, quality, and traceable food, and improve the climate mitigation and more adaptation in the continent. This is simply is the One Health approach. And I will be happy to start with communication, because without communication there wouldn't be any collaboration, there wouldn't be any coordinated efforts, and we should consider also the capacity building where we can support the health systems for the three domains, and digitalization of data and information. Why we want to digitalize? To make it shared for all the stakeholders across sectors, and also for the public, for the grassroots, so that they can benefit from the data collection at the health systems. Okay, the key innovative solutions for AU-IBAR, working in partnership with different stakeholders and sectors. First of all, we are thinking of communities-centric One Health approach. What are the needs and demands of our communities? We shouldn't come up with top-to-down approach, bringing some problems that are not the demand of the community to prevent or to control. And we should ensure that all the grassroots needs are well addressed for inclusive and equity of health interventions. The other thing, we should promote community engagement and ownership, and my colleagues presenting before me speaks a lot about the community animal health workers, the community health workers, and all the community-based workers for One Health. And this will ensure the sustainability and the resilience of One Health and awareness. The other solution we are thinking about to promote the One Health approach in the continent is the public-private partnership, where we can promote the community-based surveillance system coming from the community themselves. But this to happen, we need private sector to support those community animal health workers for sustainability, and we need to be linked also to the public authorities, where disease reporting and surveillance is the mandate of these authorities, whether for animal or for humans or ecosystems. Develop and implement community-led One Health training curricula, and it's more on awareness raising, and establishing community private-public hubs to provide advice, information, and support. And I think in this we are trying to do this in collaboration with the World Organization for Animal Health, WOHA, founded as OIE. And also, we need to identify champions and One Health trainers within the community. The third solution we are currently now promoting, and this will be, the rest of my presentation will be about it, is the digital One Health. There is a need for digital technology to ensure the effectiveness of the health systems, and the digital One Health will promote the efficient interactions. If we can see in the screen in this graphics, the One Digital Health will incorporate the data, and it will create platforms for sharing the data, where you can promote the education One Health, you can promote information from the ecosystems, populations in society, and to promote also and to share data on individual health and well-being. So, speaking about the key visions and actions for AU-IBAR in promoting the One Health, we are working under three technical thematic areas. The first one is the animal production, where we promote the good management practices at farm level and for pastoral community, and conservation, sustainable utilization of animal resources, and safe and available feed and fodder for the animals. The second area is the animal health, where we are strengthening and supporting member states to strengthen their surveillance systems, to promote the One Health and strengthening the animal health policy frameworks. The last area we are working for is the economic trade and market, and here mainly we are supporting countries to comply with the international standards, sanitary and phytosanitary measures in particular, and to gain access to market. So the vision is informed by our livestock development strategy for Africa, LIDESA, which was adopted by the African Union member states in 2015. And this, from LIDESA, we have developed the strategy for animal health for Africa, known as AHSA, from 2019. And the AHSA has different strategic objectives, 6 objectives, but if you look at number 2 and number 3 strategic objectives, it's mainly One Health. We're speaking about reducing the disease risks and impacts on animal and humans and environment, and also strengthening animal health interventions to address the current and emerging risks of public health concern at the human-animal environment interfaces. There is many documents under the African Union informing the antimicrobial resistance and also the sanitary and phytosanitary measures. Through these strategic objectives, AU-IBAR aiming to develop projects and working with the African Union member states to achieve these strategic objectives through the program of the AU-IBAR. What are the actions through the year since 1951? Many projects were implemented, but speaking about One Health, we have 4 domains. The first one, strengthening the animal health interventions to address the current emerging and re-emerging diseases. So what we have worked for through the years is strengthening the capacity of epidemiological surveillance at the African Union member states to address the risk of highly pathogenic avian influenza, Rift Valley fever, trypanosomosis, and other diseases. The other thing is strengthening of epidemiological and diagnostic capacities, and also the passive surveillance or reporting system. A long time ago, the AU-IBAR developed and established a data sharing platform, which is the African Animal Resources Information System, which is known as ARIS. Currently, we are launching the 3rd version of the system, and it's a system enabling all the member states to share their outbreaks, notifications, and animal health problems to the center, to the server at AU-IBAR. The fourth intervention is strengthening the animal health governance. We have a very famous project across the continent called VetGov, and through this VetGov, we supported many countries to update their legislations to improve and enforce the implementation of these legislations. The other domain is to promote the One Health. We are working in good collaboration with our African Union institutions, naming AU-CONVAC, the Pan-African Vaccination Center, and also with the Africa CDC and the Authority for African Union for Plant Health and many other institutions. So the main issue under One Health currently we are coordinating and establishing is the project of the African Union One Health Data Alliance for Africa. Then we are also working to reduce the spread of antimicrobial resistance in animal production and food sector, and strengthening the animal, the AMR surveillance in animal production and food. The last thing is to strengthen the safety and control systems for animal feeds and fodders of animal origin through supporting the livestock identification and traceability, and also supporting and strengthening the capacities of the countries to comply with the sanitary and phytosanitary measures. So the project, what we call it OHADA, is financed by GIZ and has been launched August last year, 2023. The overall objective is to have and improve technical and institutional capacities for digitalized One Health management and governance in Africa. It has 3 specific objectives. The first one is to have a continental One Health information policy and One Health information architecture developed and endorsed. The second one is to have technological and institutional prerequisite for digitalized One Health governance and management operationalized. And the third one is foundations for building human capacities for operationalization and maintenance of the One Health digital information established. So the main idea to have a continental digital One Health platform. This platform is not aiming to generate new data. It's just a platform open for all the stakeholders to share their data in. So we integrate the data in one platform for the use of the different sectors. The first component is to have an African Union Digital One Health information policy. The second one, to associate this policy to a One Health information architecture, and then to build the capacity to enhance this digital One Health and enable digital One Health coordination environment and sustainability. And this will be done through the countries, of course. That is why we are looking for the buy-in from the countries after developing the platform. So the role of AU-IBAR is just to make this platform available for the African Union member states, and then it will be used at the continental level. The 4 outputs of this project, the first output was achieved last year. We are very grateful for this. We have endorsed the African Union Information Policy and the associated One Health Information Architecture. This was adopted and endorsed by the Specialized Technical Committee for the African Union and endorsed by the ministerial level committee, including the Somalian Minister for Livestock, State Minister, Dr. Sulaiman was there last November in African Union Commission. The second output is to have a well-trained and robust One Health expertise for delivery of effective health systems, and this will start after completing the development of the platform. The third output is to have efficient continental One Health digital platform to guide multi-sectoral decision-making, interoperability with national platforms, and to have a feedback loop within the countries and use the cases at the national level. The fourth output is to have a robust and enabling One Health policy environment for improved One Health governance and management. So the key achievements, as I said, the first thing, we launched the project last year in August, and then the technical working group, as you have seen here in this diagram, we have 4 technical working groups for this project, has been formulated and working now. The project was well promoted during the 2nd Africa Health Tech Summit, October 2023 in Rwanda, and as I have said, the STC in November 2023 endorsed the formulation of the One Health digital One Health information policy with the information architecture. In the last week, we had the workshop on the proposed digital One Health platform prototype to discuss the prototype and to develop it further, and it was conducted in this February 2024. So the component of the proposed One Health information policy is to have the One Health information architecture where we have all the data standards, data harmonization, data privacy, consider also the user needs and use case and the feedback loop. The second component is the capacity building of the digital One Health technical competences where we have all the data information, the risk communication, and the data centers, the governance. The third component of the information policy is the enabling digital One Health coordination environment and sustainability, where we have the One Health Secretariat, African Union One Health technical working groups, and the digital One Health governance platform. So this is just an example for the platform where we'll have the early disease detection and prevention and response. There will be also the trends and prediction, evidence-based policy formulation for disease governance management, and community-based awareness creation, regulatory compliance, socioeconomic impact, and all these will be at continental, regional, and national user needs. And to use the case of the surveillance and epidemiology of the Rift Valley fever, so the data will be composed of environmental data, vector population, livestock movement, pastoralism, trade, surveillance data, some geospatial data from NASA, Ministry of Health, Ministry of Livestock, and also research institute communities. We also thinking of adding the Ministry of Trade, county, district, chambers of commerce, and the Ministry of Livestock, of course, and Ministry of Health. So the data will be collected, validated, cleaned, and shared at the platform. So I arrived at my last slide for today. What is the way forward for OHADA project? The project will be concluded by end of 2024 or mid-2025. The Continental One Health platform will incorporate also artificial intelligence, and this is the next step that we are thinking of. Machine learning, large language models for the disease modeling and early disease detection and surveillance, predictive modeling for zoonotic diseases, risk hotspots, and risk identification even in the areas where we cannot have data to model the risk of the disease. One of the outputs and the results that we can gain from this platform, also the geospatial risk mapping based on the non-environmental and geospatially available data to create the disease risk hotspot maps, and also socioeconomic activity mapping based on financial data and social data, and alert model, create customized alerts that are automatically sent to the users. And this platform will be like the hub for the data shared by all the continent. And from this, we can also think about mobile service for the alert on some diseases, outbreaks, or environmental conditions. And by this, thank you for your attention. Shukran jazeelan.
Questions in case.